High creatinine. Take these 3 vitamins to heal your kidneys. Have you ever thought about how the smallest nutrients in your body could make the biggest difference to your kidneys? When we talk about kidney health, most people immediately think about what to eat or what to avoid. But very few realize that certain vitamins are absolutely essential for kidney repair. These vitamins don't just add nutrition, they help your kidneys breathe, filter, and heal on a cellular level. Every second, your kidneys work to clear toxins, balance minerals, and regulate blood pressure. But when creatinine levels rise, it's often because those kidney cells are under oxidative stress, struggling to filter and regenerate. The right vitamins help control inflammation, improve blood flow, and restore filtration power, not as quick fixes, but as natural tools that support your kidneys from within. Whether your creatinine levels are slightly elevated or your GFR has begun to drop, giving your kidneys the right nutrients can make a visible difference over time. So today, let's explore 3 powerful vitamins: vitamin E, vitamin B12, and vitamin K2 that help heal your kidneys, protect them from damage, and support your body's natural detox process. Let's start with the vitamin your kidneys quietly depend on to stay protected, energized, and free from internal stress. Vitamin E is often called the guardian antioxidant of your cells, and for good reason. Your kidneys filter nearly 200 liters of blood every day, and in that process, they are constantly exposed to oxidative molecules. When free radicals build up faster than your body can neutralize them, your kidney tissues begin to experience microscopic inflammation. Vitamin E steps in here as a shield, protecting the delicate cell membranes of your nephrons from this oxidative assault. High creatinine levels often signal that filtration efficiency has dropped due to cellular injury or inflammation. Vitamin E helps reverse part of this damage by improving the resilience of kidney cells. Its lipid-soluble nature allows it to enter the cell walls and prevent the oxidation of fats, a process that otherwise leads to stiffness and dysfunction in kidney membranes. Healthier membranes mean smoother waste transfer and better creatinine clearance. This vitamin also plays a major role in enhancing blood circulation within the renal system. By reducing the stickiness of platelets and preventing oxidative damage to red blood cells, vitamin E ensures that oxygen-rich blood reaches even the smallest capillaries in the kidneys. More oxygen means better energy production, faster cellular repair, and improved glomerular filtration rate, all essential steps toward lowering creatinine. Vitamin E supplementation can significantly decrease oxidative markers and restore antioxidant enzyme activity in patients with early-stage kidney disease. This means that your kidneys can process toxins more efficiently when oxidative stress is under control. It's not about taking high doses. It's about steady, adequate intake through natural food sources that your body can absorb comfortably. You can find natural vitamin E in foods like almonds, sunflower seeds, spinach, avocados, and extra virgin olive oil. These whole foods deliver vitamin E in combination with other supportive nutrients such as selenium and magnesium, which together enhance absorption and kidney protection. Just a handful of soaked almonds or a drizzle of olive oil on your salad can be a powerful daily step toward healthier kidneys. Vitamin E also helps reduce chronic inflammation, one of the silent drivers of kidney damage. By lowering inflammatory cytokines in the bloodstream, it gives your filtration system a chance to rest and repair. When inflammation decreases, swelling in the kidney tissue subsides, blood pressure becomes easier to regulate, and your overall filtration improves naturally. Another important benefit of vitamin E is its ability to protect against complications caused by diabetes and high blood pressure, 2 major contributors to kidney decline. By stabilizing cell membranes and preventing oxidative injury to blood vessels, it slows down the chain reaction that leads from high glucose or pressure to kidney scarring. This makes vitamin E a quiet but effective supporter for long-term kidney resilience. If you're considering adding vitamin E supplements, always consult your healthcare provider first. Too much can interfere with medications or affect clotting, especially if you're on blood thinners. But when taken in safe, recommended amounts, it becomes one of the most reliable nutrients for kidney protection. So remember, Our vitamin E isn't just a beauty vitamin, it's your kidney's natural armor. By including it regularly through nuts, seeds, and greens, you strengthen your body's defense system from within. Over time, the single nutrient can help lower oxidative stress, stabilize creatinine, and support your kidneys as they quietly do the hardest work your body depends on every day. If you like this kind of kidney healing content, type 1 in the comments, and if you don't, type 0. We create these videos to help you protect and strengthen your kidneys naturally. Now, let's talk about the vitamin that fuels your kidneys with the energy and oxygen. Vitamin B12. They need to stay strong, efficient, and balanced. Vitamin B12 is often called the energy vitamin, but its real magic lies in how it supports every cell in your body, especially the ones inside your kidneys. Your kidneys rely on a steady supply of oxygen and nutrients to filter blood effectively. When B12 levels drop, red blood cell production slows down, and oxygen delivery to kidney tissues decreases. This oxygen shortage can lead to fatigue, slower healing, and higher creatinine levels. That's why B12 is so important. It keeps your blood healthy and your kidneys energized. One of the most overlooked causes of kidney strain is poor circulation. Vitamin B12 helps prevent that by supporting red blood cell formation and maintaining proper hemoglobin levels. When your blood carries enough oxygen, your nephrons, the tiny filters in your kidneys, can work efficiently without stress. Think of it as improving your kidney's breathing room. With better oxygen flow, filtration improves, waste clears faster, and creatinine naturally decreases over time. B12 also plays a protective role at the DNA level. It helps repair and replicate cells, allowing your kidneys to renew damaged tissues more effectively. When oxidative stress or high blood sugar harms kidney cells, vitamin B12 helps rebuild them from the inside out. It's a quiet restorer, not just preventing further damage, but actually helping your kidneys recover their strength slowly and steadily. Another important function of vitamin B12 is its role in managing homocysteine, an amino acid that can cause inflammation and blood vessel damage when it builds up in the body. High homocysteine is closely linked to reduced kidney function and heart problems. B12 keeps homocysteine under control by converting it into a harmless compound, protecting your kidney's delicate blood vessels and ensuring smooth circulation. Low levels of vitamin B12 are surprisingly common, especially in people with kidney disease or those following vegetarian diets. Because B12 is found primarily in animal-based foods, deficiencies can appear quietly, leading to tiredness, numbness, dizziness, or pale skin. For kidney patients, this deficiency often worsens. Because the kidneys play a role in absorbing and activating certain nutrients, without enough B12, toxin buildup increases, and energy levels drop even further. The best natural sources of vitamin B12 include eggs, fish, yogurt, milk, and fortified cereals. For those on a plant-based diet, fortified plant milks or B12 supplements are helpful alternatives. Choose methylcobalamin-based B12, the active form your body can absorb most efficiently. Always follow medical advice before supplementation, especially if you're managing high creatinine or on medication. One of the unique benefits of vitamin B12 is its effect on nerve protection. Kidney disease often leads to tingling, numbness, or muscle weakness because toxins affect nerve pathways. B12 nourishes the nervous system and helps repair those pathways, improving not only kidney performance, but also overall vitality and focus. Clinical studies have shown that correcting B12 deficiency can improve kidney-related fatigue, lower homocysteine, and support healthier filtration. It doesn't act instantly, but with consistent intake and proper hydration, the results build over time. Your energy returns, your circulation improves, and your kidneys feel lighter and less burdened. So, when it comes to healing high creatinine and supporting filtration, don't overlook vitamin B12. It's not just a nutrient, it's your kidney's oxygen supplier, repair agent, and quiet energy source. By keeping your B12 levels in balance, you help your kidneys do what they do best: cleanse, restore, and protect your body, one filter at a time. Finally, let's explore a quiet but powerful nutrient that protects your kidneys by keeping calcium in the right places. Vitamin K2 is different from most vitamins because it doesn't work through energy or immunity. It works through balance. Your kidneys constantly manage calcium and phosphorus levels, filtering out what your body doesn't need. When calcium ends up in the wrong place, like inside your arteries or kidney tissues, it can slowly harden and damage filtration structures. Vitamin K2 activates special proteins, such as matrix GLA protein, that bind calcium and guide it safely into your bones instead of your kidneys. This small correction in mineral placement can prevent years of slow calcification and protect your filtration rate. Rising creatinine isn't always about toxins. Sometimes it's about restricted blood flow and stiffened vessels. Vitamin K2 helps relax blood vessels and keeps them elastic, allowing smoother circulation through the kidneys. When blood flows freely, oxygen delivery improves and your kidneys can process waste more efficiently. That's why researchers in the Journal of Vascular Research call vitamin K2 one of the most promising nutrients for long-term kidney and cardiovascular support. Unlike vitamin K1, which is found in leafy greens and mostly helps with blood clotting, vitamin K2 works deeper inside the body. It partners with vitamin D3 to make sure calcium is properly absorbed and utilized. Without enough K2, even healthy calcium intake can backfire, leading to buildup in soft tissues, something the kidneys struggle to handle. This synergy between D3 and K2 supports both bone density and renal strength, keeping your mineral balance stable. You can find vitamin K2 naturally in foods like natto-fermented soybeans, aged cheese, egg yolks, and grass-fed butter. For those who prefer plant-based options, small amounts are formed in the gut when your microbiome is healthy. Another reason why good digestion matters for kidney health. Adding just a few K2-rich foods weekly can provide a strong protective effect without needing high-dose supplements. When the kidneys are already under stress, even minor calcification can make filtration more difficult. Vitamin K2 gently reverses this process by activating proteins that help remove excess calcium deposits. This doesn't happen overnight, but with consistent intake, studies have shown noticeable improvements in vascular flexibility and reduced calcium load in soft tissues within months. People with kidney disease often have lower K2 levels because restricted diets limit animal and fermented foods. That deficiency can accelerate both heart and kidney complications. Restoring K2 through food or a low-dose supplement, as advised by a healthcare provider, can help stabilize the relationship between your cardiovascular system and kidneys, two organs that constantly depend on each other for balance. Vitamin K2 also contributes indirectly to lowering creatinine. By improving blood flow, reducing inflammation, and maintaining tissue elasticity allows the kidneys to filter more efficiently. It's not a cleansing vitamin, it's a correcting one. It restores the natural order inside your body so your organs can work without strain. As with all nutrients, balance matters. Too much K2 supplementation without guidance isn't necessary. Focus on regular dietary intake and pairing it with healthy fats for better absorption. Always check with your doctor, especially if you take anticoagulant medication, since K2 can influence clotting factors. So, remember this, vitamin K2 may not get as much attention as others, but it quietly prevents one of the biggest threats to kidney health: calcification. By guiding calcium away from your kidneys and into your bones, it preserves your filtration power, keeps your blood vessels clear, and allows your body to function with ease. It's a simple, natural way to protect your kidneys, not by forcing them to work harder, but by helping them work smarter. Before we move on, let's talk about one of the most underrated yet powerful kidney healing tools: gentle yoga. When your body is tense, your kidneys feel it too. These small but vital organs are sensitive to stress, poor circulation, and fatigue. A few minutes of calm movement every morning can make a big difference in how well your kidneys function throughout the day. Start with diaphragmatic breathing. Sit comfortably with your spine straight. Place one hand on your belly and slowly inhale through your nose. Feel your abdomen rise as you fill your lungs completely, then exhale gently through your mouth. This deep breathing increases oxygen flow, lowers blood pressure, and relaxes the adrenal glands that sit just above your kidneys. Do this for 5 minutes to calm your entire system. Next, move into cat-cow pose Marjariasana Bidalasana. Begin on your hands and knees, with your palms under your shoulders and knees under your hips. As you inhale, lift your head and tailbone toward the ceiling, arching your back. As you exhale, round your spine gently, tucking your chin to your chest. Repeat this slow rhythm 8 to 10 times. This simple motion massages the area around your kidneys, improving blood circulation and lymphatic drainage. Then try Child's Pose Balasana, a deeply restorative position that allows your back and kidneys to relax. Kneel on the floor, sit back on your heels, and slowly bend forward until your forehead touches the ground. Stretch your arms out in front or place them beside your body. Stay here for a few minutes and breathe deeply. This posture releases tension from your lower back and improves kidney energy flow according to both yoga and Ayurvedic traditions. Another excellent move is the seated spinal twist, Ardha Matsyendrasana. Sit with your legs extended, bend your right knee, and place your right foot outside your left thigh. Inhale and lengthen your spine. Then exhale and twist gently toward the right. This pose improves digestion, supports detoxification, and gently compresses the kidney area, encouraging better blood circulation. Repeat on the other side. If you prefer something even simpler, try legs up the wall pose Viparita Karani. Lie on your back and extend your legs up against a wall, keeping your body in an L shape. Close your eyes and relax for 5 to 10 minutes. This posture helps reduce swelling, improves venous return, and gives your kidneys a gentle boost in blood flow while calming your mind. Gentle yoga isn't about sweating or pushing your limits, it's about relaxation, breath, and awareness. When your body feels safe and supported, your kidneys can function more efficiently. Practice these movements daily, especially in the morning or before bedtime, and you'll begin to notice not only improved energy, but also a deeper sense of calm from within. Now that you've learned about these 3 powerful vitamins, vitamin E, vitamin B12, and vitamin K2, it's easy to see how small nutrients can create big changes for your kidneys. Each one plays a unique role in protecting, restoring, and supporting your body's natural filtration system. Vitamin E acts as your kidney's shield, protecting delicate cells from oxidative stress and inflammation. Vitamin B12 fuels your red blood cells and boosts oxygen flow, helping your kidneys stay energized and efficient. And vitamin K2 keeps calcium out of your kidneys and arteries, guiding it into your bones where it belongs, protecting your filtration system from silent calcification and stiffness. These 3 vitamins work best when they're part of a clean, balanced lifestyle. Healing high creatinine isn't about quick fixes or single supplements, it's about creating a consistent environment where your kidneys can repair themselves. Combine these vitamins with a low-sodium diet, adequate hydration, and gentle physical activity. Over time, this combination helps reduce oxidative stress, improve circulation, and bring your body back into balance. Remember, your kidneys are resilient. They respond beautifully when treated with care, consistency, and nourishment. Even small changes, like adding a handful of nuts for vitamin E, eggs or fortified cereals for B12, or fermented foods for K2, can make a lasting difference. The goal isn't perfection, it's steady progress toward better filtration, lower creatinine, and a calmer internal system. If you found this video helpful, comment "healing" below. Your small word might inspire someone else to start their healing journey today. Every video we create here on kidney health is designed to help you protect, strengthen, and naturally support your kidneys, one habit, one choice, and one healing step at a time.